It's Thursday, April 2nd, and time for your Barbados Today morning news update. Government stops short of a full lockdown of the country but announces tougher restrictions to curb the spread of COVID-19. Among those measures, all parks and beaches are now closed and the sale of alcohol has been banned for the next 2 weeks. Acting Prime Minister Cynthia Bradshaw made the announcement in an address to the nation last night as the number of COVID-19 cases increased by 11 from 34 to 45. Minister Bradshaw said that number was simply too high and the measures were necessary in an effort to turn the tide.
All beaches and parks shall be closed, and no more than 10 mourners, 1 officiant, and the funeral director and the necessary staff shall attend a funeral. No more than 1 person at any time shall visit a patient in a hospital, a nursing home, maternity home, or facility for the treatment of persons with an addiction or dependency on drugs or substances. No person shall leave his residence except to purchase food or medicine, or to seek medical or dental attention. They shall not leave to do anything other than banking business, to work in an essential service or in a business that is exempt from this directive. No group exceeding 3 persons who are not members of the same household shall remain outdoors unless they are within the curtilage of their residence. And during this period, the sale of intoxicating liquor is hereby prohibited.
The acting Prime Minister said government did not take those measures lightly as it affected the livelihoods of many families.
During this period of heightened measures of lockdown, as some may call it, we expect that supplies for some may run low. And we know it will be tough on some families. But we have got to stay on lockdown so that the health officials can get a handle on this problem. We need for everyone to stay still so that we know exactly where the virus is and who should be treated for it. If no one new enters the country and each of us remains in our home and our neighborhoods, then health officials can better identify, access, and act upon the emerging cases. By the end of this 15-day period, we should be in a better position to gauge and to know the extent of the spread of the disease so that we can put the appropriate measures in place to have it managed and contained.
But the head of the Barbados Private Sector Association says government's move to further restrict the movement of people in a bid to curb the virus is still not enough. Edward Clark tells Barbados Today the restrictions would simply manage rather than stop the spread of the virus.
My concern is that there's still going to be a significant amount of people still moving around to go to the supermarket and so on, and those are the issues that we've been facing already. And I don't know how they're going to practice the social distancing unless it is policed properly. And, you know, this has been an issue for many people. The issue is that if it is here, whether or not people go, the same people are going to take the virus out and it's going to continue to spread. And at some time we have to take the very serious decision of locking down this country fully, barring going to the hospital. Or medical emergency, because we are trying to manage it, but we are leaving cracks in the system whenever we don't make the final decision. And I know it is hard, it is very difficult to have to do.
Clark said there is a need for more stringent conditions if the country is to win the fight against COVID-19.
It is a tough decision to have to make. It's almost like a warlike orders, and I know people are accustomed to freedom and democracy, and freedom aren't accustomed to such. But these are difficult times for our world and our country, and we really need to have very stringent conditions if we are really going to beat this virus.
A former central bank governor has been putting forward suggestions on how the country can manage the fallout of the COVID-19 pandemic. In his April economic letter, Dr. Delisle Worrell recommended, among other things, that special COVID-19 bonds, financial support for entrepreneurs, and testing for all medical workers, as well as those at the island's ports of entry, be put in place. He said measures to speed up the payment of unemployment benefits were also welcomed.
Those benefits should continue for the duration of the period of unemployment resulting from the COVID-19 crisis. Grants or other financial support should also be available across the board for taxi operators, hairdressers, owners of gyms and spas, other self-employed persons, and workers in the informal sector. It may also be necessary to provide support for profitable larger enterprises if they would otherwise not be in a position to carry on when economic activity resumes in the country. The government should issue special COVID-19 bonds with a low interest rate and a sufficiently long grace period to be bought by the Central Bank of Barbados. These bonds should be issued in whatever quantity is needed to fully finance both the medical requirements for containing COVID-19 and the income maintenance support for workers and companies.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To news from the region now. COVID-19 cases in the Bahamas climbed to 21 as the country confirmed its first death due to the contagious virus. More in this report from ZNS News.
18 of those cases recorded in New Providence, 3 of those in Grand Bahama. The Prime Minister noting that health officials are now vigorously conducting contact testing.
The hotspot that we have identified is confined to the eastern end of New Providence. It's in the east. I've already communicated this information to the Commissioner of Police, and he has stepped up and ensured that everyone, inclusive those in the east, adhere to the curfew and adhere to policies that the government has instituted. I want to address this afternoon the death of an individual who was transported from Bimini to New Providence. The COVID test on this particular individual has been positive.
And finally, UN aid agencies have requested special exemptions for aid deliveries as COVID-19 threatens global shipping and air supply chains. The bid comes as those agencies work tirelessly to get aid to most needed regions as the virus continues its advance towards vulnerable population hotspots, including in Eastern Democratic Republic of the Congo, Syria, and Libya.
Libya is at high risk of the spread of COVID-19 because of its level of insecurity, weak health system, and high numbers of migrants, refugees, and internally displaced people. There are now 8 confirmed cases, 2 of them in Tripoli, 6 of them in Misrata, and a total of 112 suspected cases. Ongoing clashes, but also COVID-19 restriction measures are hampering humanitarian access and the free movement of medical and other humanitarian personnel and other humanitarian assistance across the country. We are asking in individual countries for exemptions to movements of essential personnel that needs to move. That is a country level negotiation that is going on.
That's news. But But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.